Welcome to Ask the Cabinet. I'm here with the leader of Peterborough City Council, Dennis Jones, and the Cabinet Member for Public Health and Adult Social Care, Dr. Shabina Qayyum.
Hello.
How are you both?
Very fine, John, thank you.
Very well. I didn't want to say it myself, but you certainly are. So every month we run this with members of the Cabinet, and we ask for questions. We look for stories that are in the news and things of interest. I thought we'd start off with the health consultation. And Dr. Shabina, obviously that is going to be one of your projects, one of your things that you're very interested in. This is a consultation into public health behaviour change. And do you want to explain it to people if they don't know anything about it, what actually that consultation is looking for and why it's come about?
Yeah, so I'll pick up on your words. It's actually a consultation. Nothing's been taken away yet. We're having to make savings in the public health budget of £440,000 to our services. Some of them are services that aren't mandatory, and some of those are services that we have to fund, like your sexual health services, smoking cessation, and also children's health services, which are mandatory. Nothing's happening to them, to those services. This is asking the opinion of our population as to how they would like to see adult weight management services run. So currently we have what we call Tier 2 and Tier 3 weight management services. And your Tier 2 weight management services comprise of your adult weight management advisors, as well as your health trainers. And the thought process behind it is that we always look at evidence in public health. It's quite clinical. And the evidence that we've seen where we've put this funding towards has revealed that the weight loss that people have as a result of using that particular service hasn't been great. So you can imagine a patient that says, oh yeah, I really do want to lose weight, and then has access to the Tier 2 weight management service of the health training that's provided, and come out 3 months later or in their 6-week or 12-week program and say, oh, well, that's 12 weeks of my life gone. I didn't really lose anything. And the data has shown that there hasn't been a significant improvement in the weight loss of the population who've accessed that service. So you look at it and you think, number one, is this cost effective for taxpayers' money? Number two, is it achieving the outcomes that we want? And the answer so far on the basis of that data is not really. So we're asking the public as to what their feelings are. And it's the right thing to do to ask, put this to consultation and ask. So I hope in layman's term I've been able to put that out in simple language.
I mean, you must have seen, as obviously in your role in health, that it's easier to prevent it than cure it. So is there a case, I mean, how do we stop people getting overweight in the first place is something I guess I'm trying to ask. Is that an easy thing? What can you do to help people in that regard? It's behavioural change, I guess.
Behavioural change, and it's really good that you brought this up, John, because what I want to say is that the child obesity and the child weight management services are in place. There will be no changes to that whatsoever. And it actually involves education from home as well. So we're going to be using a lot of the resource for people to access online. We know we're in the age of social media and internet access. A lot of that information is already available online. You can also access weight management advice from the NHS online. So if we are able to put out the right information, target it towards the right audiences who it would benefit, I think that will prove as beneficial in the outcome. But prevention, you're absolutely right, is better than cure.
When I look on social media, people talking about weight loss and health and exercise, it's quite expensive sometimes to get the right food, or joining a gym or doing things like that are quite expensive. What do you say about that, Dennis? Because I did a quick bit of research, very quick bit of research. All of these are free. Outdoor gyms we've got, Stanley Park, Millfield. There's lots of yoga sessions, Cathedral Grounds. There's an annual sports taster day coming up at Central Park. Various things. So I guess we would say that there are other things out there, facilities to change if you want to get healthier.
Yeah, I think partly it's awareness. If there's a part that we as councillors can play as cabinet members is to keep increasing that awareness that these things are out there. because sometimes we look but we don't see. And also now there's a far greater effort on nutrition and things like that. So we play our part in that advocacy. We need to play our part in that, and we've got to go off clinical evidence, but by the same token, we just need to encourage people more and more to be aware of what is out there. And I think, again, there's a level, some people are quite self-conscious about using stuff.
Because obviously, swimming pools will always be in the news in Peterborough as well. People will also comment on the fact that there are some green spaces that have been in the news as well, maybe under threat, because we're talking about mental health as well, with those sort of things. And what would you say to them, Dr. Shabina? What would you say to people who sort of say, well, there's things closing, what can I do? That sort of thing. What would you say?
So I'm always of the opinion that green spaces absolutely wonderful for health. You only have to look around the corner and have a look at Rail World Wildlife Haven. It's a beautiful, serene example of a volunteer-run organisation where nature meets. It's a jewel in the crown of the city when we talk about green spaces as well. Areas like the Green Backyard, again, going to consultation. Nobody's made a decision on it as yet. I say if you're going to sit at home and say that you anticipate that it's not worth going there because it's going to close anyway, then you're not helping yourself. And I say to a lot of my patients with my other GP hat on, we can help you if you help yourself. You can lead a horse to the water, but you can't make them drink it. So it's really important. There are lots of resource out there. You've got the beautiful Ferry Meadows. You've got the Neen Park Trust. There's a lot of green space. I take walks in the evening around the Holywells area, just behind Thorpe Park. It's about getting out and about, making use of the amenities that we have and enjoying it. And I just say, look at COVID, where we were all confined in our own houses. At that time, we all took advantage of exercising with Joe on the internet, and people were able to innovate. In the same way, get up, don't think about it, come off your tablet or your social media and just go out there and do it.
I guess the issue about that is that some people will think to themselves that their healthcare has been provided for them. In other words, oh, well, I won't bother losing weight, I'll just get a vaccine, or I'm taking it to a dramatic end. I know I am, but some people I remember speaking to somebody about that and saying, if somebody had offered you free healthcare sessions or exercise instead of, vaccine or mask or prevention, would you have taken them? He said, no, I'd rather. So, like you said, it's behavioural change is difficult, isn't it? But you can lead the horse.
But you can't make them drink it. And it's always important that we get the language right. We can help you if you want to help yourself. And I apply this to every facet of illness that people have. There will be some people that actually do need that help. They will need clinical input. They will need to be given information and resource. But those that do have the information and resource that involves a bit of self-help, you have to motivate them enough and say it's there, it's available for you. Go out there and use it. We're here to help you. That's what we're here for. But go out and use those facilities.
Final question on this: the consultation. When's it running up to? Where do you respond to it?
So it's running up for a couple of weeks. I think it's about to close in a couple of weeks' time. We will see the respondents. It's been promoted avidly on social media. So for those that are watching, please do take part.
I'd always recommend people getting. One thing we've done since we came into administration, we've tried to be as consultative as we can. And this is yet another way that you can have your say and we will listen.
Now, next up, I was going to talk about gambling in the city centre. Now, our MP has spoken about that recently. Concerns have been voiced that Peterborough is gambling with the future of its city centre as the number of betting shops and gaming centres grow. That's in the PT, and obviously we can go into the story about that. There's a few of them around, certainly on Broadway where I live. There's quite a few at the top. We had some interesting comments online. James Bice, I'm not against gambling at all, and a proper casino would probably be an excellent development for the city, but surely the number of slot machines, especially in the city centre, is beyond saturation point. Caroline Horner said, "Why is it okay to have rows of these in a seaside town but not a city centre? Don't get me wrong and start having a go at me. I'm just curious." So she was obviously aware of. I mean, is there anything much we can do about that, Dennis? Is there anything much about those? So we've spoken before in our previous podcast about having empty buildings instead.
That's right.
What's the
It's the eternal dichotomy, because on the one hand they do pay business rates. The downside of that, and I'm very fortunate, I'm not a gambler, so I can walk around a casino, as I've done on a couple of occasions, with my hands in my pocket, so it doesn't bother me at all. But we are, there was something about the profit from them is something like £32,000. I think it was something that was quoted. And we have reached a point, we have Operation Can Do in the Millfield area. We reach a point where enough is enough. I just don't think we can sustain any more, no matter how much business rates they're paying. People can gamble online. It's a fairly, what I tend to find is that these are fairly solitary activities. So unlike when there used to be lots of pubs around, then at least there was a social element to it. Yeah, I don't see any of that in the slot machines, but that's my personal view. This isn't a political view in any way. The one thing about the seaside towns, having worked at the coast many moons ago, it's for a short space of time. These are 24/7, 52 weeks of the year. The seaside towns run for, at best, 15 to 20 weeks. And of course, this is where you people can go, and they're on holiday. Exactly. It's a leisure activity. They've got so the slot machines. You're not really comparing apples with apples on that one, I'm afraid. But I think we are reaching a point across the generations where the equipment now is much smaller, lighter, easier. Like I say, you can gamble online. All I'd suggest to anybody is be mindful and gamble as responsibly as you can within your own means, if you are going to use these now that they're here.
Andrew Pex has also suggested that he's going to work with. He wants to see the City Council take a tougher line, and he wants stronger action in planning policies and also the local plan as well. So, can anything be done about it within that?
Very, very difficult. I'm no planning expert, as we all are. We're lay people. What we need to do is look at what provision has been made, and we need to have a look to see, is there anything we can do? Can this be done sensitively? Nobody, gambling, it's a free country, if people want to gamble, but I think the proliferation of the centres, particularly in certain areas, they tend to proliferate in areas of high deprivation. And, this is one of the toughest things that we have to come across. So I don't know is the honest answer to your question, but I think certainly when we look at the local plan, these are things. I think the priorities for us is when we're looking at development, sensitive developments with the kinds of services like doctors, dentists, shops, etc., rather than just putting houses everywhere or just rows of these machines. I don't think that is going to help anybody anywhere, to be quite frank, no matter where you are.
And we spoke in the first question about health and maybe addictions with regarding to food and breaking like behavioural issues. I suppose gambling an addiction as well. So you must see that sometimes as well.
We do. The way gambling, in my own clinical scope of practice, I've seen that gambling actually wreaks havoc on not just the individual, but it's linked with other addictions as well. Gambling, or people that prolifically gamble, have found to be addicted to alcohol, for example. There are drug paraphernalia that's involved too. And actually, the destroying of a household, families are destroyed through addictions like this. In terms of gambling. And I think that it's really important that we recognise the societal impact that this has on an economy, especially in a small city like ours, where the number of gambling and betting shops has reached saturation point. But actually, from an economic perspective, are we actually becoming a repellent to those people who take up this activity and then find themselves unable to work because of the addictive implications and the other societal impacts that take place. I think it's worth opening up a conversation in answer to your question about the local plan as to whether there can be a limitation on the number of gambling shops in terms of licensing legislation that we can have a look into, whether there are options or incentives that are feasible for us economically to have a look at other businesses in place of gambling and betting shops. The existing ones, I'm not sure what we can do about it, but certainly it is food for thought in opening up some of those vital conversations at the wider health and societal impacts that it has on a population.
Right. Shall we talk about? We mentioned the local plan earlier on. What are the next steps, Dennis, in that, in regards to where we are at the moment? There's a sort of period going on, isn't there? You're going to publish all the comments that people have made? How
Yes,
does it work?
yes. I mean, it will take some time. When everything comes in, it will all be processed and everything will be taken into account. You've got to remember the consultation period is the start of the whole process. It's not the end. And as Shabina said about the health consultation, it doesn't finish there. In fact, it's not due to come to full council for the first time until December 26. So there's an awful lot of steps. I can't remember every single step, but there are a lot of comments coming in. And, you know, and this is a bit like the budget consultation. Everything has to be on the table. You know, we have to look at what we're going to do with spaces like the Green Backyard. You know, they've been wonderful open spaces, lungs in the heart of the city, but we're also looking at places like Castor and Aylesworth. So it has created an awful lot of buzz, and we just have to view it positively and again get people to engage in that whole process and then find out just exactly what it is they're expecting of us.
Yeah, and that is the whole point, isn't it, of a consultation, getting people engaged with it, getting people involved with it. I mean, you mentioned the Lido earlier on, going back to that as well. Where are we at the moment with the Lido? Obviously, it's reopened.
Yes.
There's a lot of events coming up as well. You've got the midnight swims, the fitness classes, the dogs, etc. Where are we in terms of the funding for it, the future of it at the moment, if you like?
What happened, the Lido had to be considered. Nobody wanted it to close, but we couldn't show preferential treatment to anything or anyone. And the Lido, when we looked at the costs, they were actually far higher than the anticipated costs were far higher than the actual costs. And we were finding ways, we're looking to put covers on, you know, we're now generating income, we're working with the friends. One of the things I'm keen to do is look to have a cooperative solution that gets stakeholders involved. And, you know, my agenda is always to make Peterborough a city of cooperation. And this would be a wonderful first step for me, that people feel that they're part of it and they're stakeholders in the city and in the Lido. It's 90 years old next year. So we're open now until the end of September. It's a very clement 24 degrees in there, as I found out last week, as you probably know. And then, you know, you've got to thank Amazon for everything these days. And, you know, we really are. But again, it goes back to that awareness piece. It's a real jewel in the crown in the centre of the city. And you've got to get in there. We've got to, as ward councillors, as officers, we've just got to get that message out there that this place is well worth a visit and you're looking at a real piece of living history. We're not going to lose it. Let's use it. Let's make a real buzz. One of the things we're working again with Brian Pearce, is there any way we can generate from solar power? Can we warm the water that way? Eventually, in the next 2 or 3 years, it will be linked hopefully with the Piri project, which will make energy from waste. It will run right through the city centre. I've been with Professor Ross Renton this morning from the university, looking at how we can create behind the Lido a cultural hub for the city, a cultural quarter, looking at sensitive development of the university sites to make it part where people can come and dwell. You know, if we can, I've always wanted to see a true cafe culture in Cathedral Square. All these places are in easy walking distance. And it's so easy to go from one place to another. And if we can create that vibe, if we can do it. I am going to get in at some stage, John. In a month, we've sold over 4,500 tickets for the Doctor Who exhibition, and over £10,000 in merchandise. And that's in a month, and it's a fabulous exhibition. And again, it's on the doorstep. It's an easy flat walk. Once the station quarters up, everything just becomes within walking distance. I'd like to see a real vibe and a buzz about the city. We've got a book festival at the end of this year. We've got some big names coming to perform here. And I'm very excited that we're partnering with the Farnborough Film Studios. And I'm looking forward to going down there in the next few months just to get some of the ideas and the buzz around it. And the Lido is just central to all of that, and we've got a wonderful cathedral, so we can all help each other, we can cooperate with each other, and we can really see something that's happening right across the city. We are an easy city to navigate and walk around. Let's do it.
We have a quick word on the new Rough Sleeper project, the off the streets accommodation scheme.
Eastfield Road.
Yes, that's the one. So I've been to that myself. I hope people have picked up on it because it's been featured everywhere recently. New properties that can help up to 17 people with multiple complex needs. And it's amazing, quite frankly. I understand we've had, I think there's 11 in there at the moment, and none have left yet. There's a few issues, but nothing. And it's going to be with people with complex needs. And it's a really nice atmosphere as well. People really it is a great location. People have thanked the City Council a lot for what we've done, and also My Housing Options as well, the CIC that's linked in as well. And it's something that we have to deal with to help these people. We want to help them as well. I mean, I don't know if either of you would like to comment on that or not. I mean, Dr. Shabina, we see rough sleepers in this city, and it's something that we really need to help and address and help them in life, isn't it?
The thing that I absolutely love about this scheme, and I know that Dennis and Alison, who's the cabinet member, I'm so pleased that this has actually had press coverage, and I'll tell you why. Rough sleepers in our city centre for years have been stigmatised around the whole antisocial behaviour element that takes place that's affiliated with them, or has been attributed to them. That's the right wording. And often they travel a path by whatever circumstances. Every one of us has a backstory, and we now have something within the city, a provision that is the first of its kind in the whole country. Let me just say that, in the whole country, that is a multidisciplinary approach. You'll have a rough sleeper that will go into this accommodation, will have a caseworker that looks after their mental health. You will have a caseworker that looks after any potential alcohol or drug addiction issues. And you will also have somebody that will work with them that will help with their confidence, to write up a CV, teach them various skills so that they can get into employment and become tenancy ready for when they do exit this provision. They are able to either go into a place of work, or they're able to go into housing, even private rented accommodation. I was just speaking to Abdul today, and actually so praiseworthy of the fact that he's thought of something so innovative. And I don't know what Dennis thinks, but actually I think he deserves, or we deserve, an audience in front of Angela Rayner to say, look what we're doing here in Peterborough. We need to shout about it from the rooftops. I think it's fabulous.
I think the only thing I would add to that is I have nothing but praise for the Rough Sleeper team. People like Kelly Slack, previously, working with people like Sarah Skase. We went out, Matt and I went out on the count last November, not out for the count, out on the count last November or whenever it was. And, and again, I had a rough sleeper issue on the edge of my ward. They went out there. Thankfully, it was a collapsed tent, but the fact that they're going out in the wee small hours of the morning when we're all safely tucked up in bed, and to have that kind of enthusiasm and passion to do those things, it's wonderful for not just for the city, but for us to share in that sense of achievement and well-being that we're trying to bring to people who are often in these positions through no fault of their own. You know, often it's not a lifestyle choice.
Yeah.
So one of the things that we need to do is be mindful of that. Yes, we don't want the beggars. Yes, we'd prefer people to have accommodation. But, you know, I've been passionate about that. We don't want anybody left behind. And initiatives like this just give grist to that mill that we really do want to see people doing well for themselves, as Shabina said. And this scheme is just wonderful. And it's a real tribute to the team that's.
It is a great team, and it's given a sense of pride to the rough sleepers as well. The very fact that rather than being put in a, I don't know, a B&B or a hotel where it might not be the right environment for them, this is actually a shared accommodation that is new and giving them a sense of purpose, perhaps, and somewhere to move.
A respect, self-respect. You know, we all deserve it. You know, that's something that I would like to see, is that we all are respectful of ourselves and each other. You know, it's a tall order, but it's a worthy one.
I've been there a few times, and I've actually quite enjoyed being there as well, which is something that you wouldn't necessarily think that you're going to enjoy, to go in and meeting with rough sleepers, but they're all full of praise for the council. So it's nice to hear it. On to the last section, if you like. This is a chance for you to boast about the council as well, Dennis, as well, because people might not be aware that Peterborough City Council's non-statutory government intervention has ended. So I would like you to sum that up for somebody who knows nothing about what that is and just make it a simple thing.
The one thing I will start with, it's been a real team effort. This was something that the previous administration, or the previous but one administration, brought in. We went to the government to borrow money because we couldn't make ends meet. And they said, we will help you find ways to make ends meet. And so we had an improvement panel in, made up of very august people from the local government association who have been nothing short of magnificent, always willing to go above and beyond the call of duty. I've been the Labour group leader, so involved with the improvement panel now for 2 years. And the fact that the government intervention, whereby they have now stepped back and they feel things aren't, we're still not out of the woods. We need to build our reserves. We have to have a rainy day fund, and they are perilously low. So there's, don't let anybody run away with the idea that everything in the garden is rosy. But what they're saying now is that we are able, in a much better position, to manage our own finances and future development than we were perhaps 2 or 3 years ago. And I have to thank previous leaders for their input into this. And I've been more than happy to receive the letter from Jim McMahon that says, we think you're all grown up and you can do this.
I noticed on social media, a few people have said, like, I want to hear from Mark Harris, improvement, question, where? And you said, Dennis, yourself, you'd have certainly noticed if we'd needed commissioners, Mark, ask Birmingham, which is very true. And it can be seen. It's still rumbling on in the, yeah.
I know the leader of Birmingham City Council. They've had the strikes there. They've had issues that have gone back an awful long time.
Still going on, isn't it? And behind the scenes,
still going on, and John's a lovely guy. And Birmingham, which is the biggest council in the country, by the way, is, I take my hat off because he's not flagged at all in his efforts, and but I certainly wouldn't wash that for our city.
Just talking about Labour at the moment, the Labour group. Have you enjoyed the last year or so being in the cabinet? Enjoyed it, leading?
Enjoyed. There's
you don't like enjoy very much, do you? I've noticed this before.
No. The thing is it sounds self-congratulatory if you say you've enjoyed it. There are tough decisions. Wayne himself asked in the chamber, were we willing to make the tough decisions? And the answer to that has been a straight certain yes. But they're not easy decisions, because if you take, for instance, Chauffeur's Cottage, we had to ask Metal to leave after being there for 12 or 13 years. When you're trying to build a cultural quarter in the city, it was a real wrench to ask them to move, but it's been given over to care leavers, and we have a duty to our care leavers. So you always have that constant dichotomy, and we made the right decision. I stand absolutely behind that decision. And one of the things now that I want to do, I feel a debt of loyalty to Metal, and that we do have these cultural events in the city to make good decisions that I wouldn't necessarily have wanted to take. And that's part of the enjoyment, that you can see that level of growth, development, and where you can take people along with you. But tough decisions need to be made, and will continue to need to be made. So although the government intervention is finished, whoever is holding the reins, most local authorities are living hand to mouth, and we have to do things better, quicker, slicker, greener. We just have to do everything far better than we have done in the past, because there's certain services now the council really struggle to provide.
Is there anything you'd like to add to that?
Yeah, I concur with everything that Dennis has said. All I'm going to say that it is much more difficult to be in power, and how Dennis has tried to work out his cabinet is to put the squarest pegs in the squarest holes, to quote his own incentive. And actually, we all have really taken the bull by the horns in terms of our cabinet positions and looked into how things work. We've had a good induction. We have a great relationship with the officers. I think we all get on very well with each other. And I think that we're also a very collaborative and cohesive administration. We will have conversations cross-party with people. We do want their ideas to come forward. We have taken ward councillors' views on board. And an example of that more recently in my portfolio is the industrial hub. Fantastic conversations with John Howard, Councillor John Howard, for his ward, in looking at that provision, recognising that hearing the voice of those residents was very important. And I'll just close on this. Where else would you have a cabinet member in Councillor Angus Ellis who knew about the legislation with waste and disposal for Bristol City Council and gave a 3-minute speech on it at one of our recent meetings? So it's been a pleasure to serve. That's all I'll say. And the future is unpredictable. I think that's the way it works in politics, but it has indeed been a pleasure to serve alongside my colleagues and under Dennis's leadership. And I hope we're given the opportunity to continue, because if anything, any upset in administrations changing is actually a disservice to our residents who expect us to work for them. Okay? It's very easy, like I say, to want power, very difficult to execute it.
I think I think you enjoy perhaps isn't the right word. Sometimes it's a pleasure to serve, and it's certainly a privilege. And I think they're better words that I would choose to use, because, I came in to represent my ward residents. Everything else I've done, either within the Labour group as the whip or the secretary or whatever, nothing prepares you, nothing, for being the leader of a council. If somebody's got a job description, they've never shown it to me. And everybody else I've asked, it's you learn on the job. And one of the things is, and I take my hat off to every one of the cabinet members, as Shabina said, okay, Shabina as a GP, perhaps Katie, but you shouldn't be asking fairly fledgling councillors to take on such responsibility. And every single one of them have stepped up to the plate and have done a magnificent job, not only for themselves, not only for, the party we represent, but for the city that, we all live in and pay our council taxes to. Let's be honest.
And just to conclude then, obviously there is a meeting on June the 18th.
There is.
Which might prove tricky. What would you say about that? I mean, you know what the speculation is in the news. Well, it's more than speculation, it's seemingly anyway. What would you say?
I think for me, people talk about coalitions and the future, and to an extent, John, I get that. But this city, the people in this city, need stability. They need consistency. They need continuity. And if somebody grabs the wheel now. Let's face it, if you liken Peterborough City Council to a vehicle, it's needed specialist mechanics that have been brought in to keep it on the road. The best we can hope for if somebody grabs the wheel is just stalls, because the agenda's moved on. The city's moved on, you know? So what we have to be careful of now is that we don't veer off to the side and we don't crash that vehicle at this particular stage. That's my honest concern. Let's wait another year. Let the ballot box decide who should be running this city, not people perhaps who think a coalition or their own way of doing things is a good idea when we really are still showing the green shoots of recovery rather than, you know, being much further along the track where we want to be in a year's time.
Okay.